name is Emily Pinto Taylor. I'm one of the geriatrics fellows, and I'm here to talk about healthy aging in the brain. So in terms of aging, some of the most significant brain changes that we see are decreased brain weight and cerebral blood flow, and then an increase in something called neurofibrillary tangles, which can be normal, but can also end up leading to things like Alzheimer's disease. As these changes occur, functionally, we know that the brain cognition slows with aging, but your IQ doesn't change. And actually, verbal skills increase as you get older. So people know about 21,000 words by age 21 and 60,000 by age 60. I think about the slowdown in cognitive processing with age, like using an older model computer. You can still do everything you need to do, but if you're trying to word process, sometimes it'll slow down or you'll see that spinning circle telling you need to wait between tasks. It's sort of a spectrum between normal aging, which we call age-related cognitive decline, all the way to dementia. And in the middle, we have something called mild cognitive impairment, which is when your memory loss is more than we expect for someone your age, but it's not so significant as to cause things like trouble working or driving or taking care of the house. You may just need some help with things like reminders. If you're worried about your memory, you should talk to your doctor, who can do a series of tests. A lot of cognitive tests that we do in the office, like naming animals or counting numbers or drawing certain pictures, which help us figure out where that memory loss is located in the brain. Sometimes your doctor may do imaging or draw blood work as well. There are some things you can do to preserve your memory as long as possible. Fortunately and unfortunately, these are things which are accessible to everybody, but are often much easier to talk about than actually change in your life. One of the things that's the best studied for memory loss associated with age is the impact of physical activity. So we recommend 6 days a week of 30 minutes of moderate strenuous activity. I usually describe it as you should be walking hard enough that you can't easily have a conversation with someone you're walking with. The other thing that's been really well studied is the impact of a heart-healthy diet. So we usually recommend a Mediterranean diet, and a dietitian may be able to help work with you to make those changes. The two things that I also recommend, but aren't as easily well studied, are the impact of social connectedness. So the more you're able to keep in touch with people in your life on the phone or take part in activities during the day. And the last one is the impact of things like cognitive activity. So crossword puzzles, doing puzzles, Sudoku, things that keep your brain active. Those aren't as easy to show in trials that they work, but they're also just not that easy to study. There's a ton of research taking place around Emory regarding brain health and healthy aging. If you're interested, you can go to alzheimers.emory.edu to learn more.